Something I've learned over the years is that parents' health matters. And right now, there's so much noise around weight loss, trends, opinions, medications that it can be hard to know what's right for you. That's why I appreciate what Weight Loss by Hers is doing. Hers connects you with a licensed medical provider who determines if treatment is appropriate. And if it is, your treatment plan is personalized to support you in reaching your goals. What I like about this model is that Hers offers ongoing care, dosage and medication adjustments as needed, lifestyle and nutrition guidance, and access to 24/7 support. And it's all done online with licensed providers who learn your story and help you make progress that you can maintain. Because taking care of yourself is not selfish. It's part of taking care of the people who rely on you. Feel like your best self again. Visit forhers.com/Dr. Wendy to get a personalized, affordable plan that gets you. That's forhers.com/DRWENDY. Forhers.com/Dr. Wendy. Weight Loss by Hers is not available everywhere. Prescription required. See website for full details, important safety information, and restrictions.
This episode is brought to you by Peloton. Break through the busiest time of year with the brand new Peloton Cross Training Tread Plus, powered by Peloton IQ. With real-time guidance and endless ways to move, you can personalize your workouts and train with confidence, helping you reach your goals in less time. Let yourself run, lift, sculpt, push, and go. Explore the new Peloton Cross Training Tread Plus at onepeloton.com.
Welcome. This is a podcast where we take the confusing, surprising, and sometimes controversial topics in kids' health and make sense of them. If you're the kind of parent who loves to stay up on health trends and is curious about what's really going on so you can keep your family healthy, new research, debates, medical mysteries, you have come to the right place because kids' health is full of puzzles, and today's episode starts with a really good one. Okay, listen, I'm going to share a story with you, and some of the clues are in this mystery. This was a baby who seemed perfectly healthy. She was growing well, developing normally, and her parents really didn't have any concerns. But something strange kept happening. About an hour and a half after being dropped off at daycare, the daycare workers would call because the baby was vomiting. And not just a little spit up, it was like repeated vomiting, enough that the daycare staff were worried. The parents would rush to pick her up, but by the time they got home and settled in, she was fine again. At first, they wondered if it was a stomach virus. Maybe something was going around the daycare, but it kept happening. And then one day, it got really bad. The daycare called, but this time, the baby wasn't just vomiting. She looked really pale, lethargic, and she really couldn't stop throwing up. So the parents rushed her to the hospital, where doctors began thinking about things that make pediatricians very nervous. Could it be a blood infection? In the emergency department, the doctors did blood work. They started IV fluids and IV antibiotics while they waited to see if bacteria was going to grow in her cultures. Because when a young infant looks that sick, doctors don't take any chances. Then something strange happened. Within hours, she looked pretty good again. Her labs were normal. She stayed overnight in the hospital. They watched her really closely, and then she went home. Maybe it was a virus. But then it happened again. Same pattern. Fine in the morning, dropped off at daycare, and then an hour or two later, vomiting starts. Was it something about the daycare? Was it something in the environment? Was it the bottle she was drinking from? At home, mom was breastfeeding, and in the hospital, she was breastfeeding. But before daycare and while she was at daycare, she got a bottle. And that small detail turned out to be the clue to the mystery we're going to unravel. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kids' health. I mix the science of medicine with the reality of parenting. Okay, what is your guess about this baby? She wasn't having an infection, and she wasn't reacting to the bottle itself. She was reacting to what was inside the bottle. Formula, yeah, this was a type of food allergy, but not in the classic sense. We're going to talk about a condition that many parents and even many doctors really aren't familiar with. It's called FPIES, which stands for Food Protein Induced Enterocolitis. Yeah, that's why we call it FPIES. And we're going to explore the fascinating and confusing condition with allergy specialist Dr. Christopher Parrish from Latitude Food Allergy Care. He's an allergist and a pediatrician and an adult medicine doctor. He's got more experience than most with FPIES, including this baby that I just told you about. All right, where should we start? Let's start with what is the classic way that FPIES shows up? Here's Dr. Parrish.
The classic presentation of FPIES is going to be what we typically refer to as acute FPIES, and that's going to typically be in an infant most of the time for their first presentation, and it is delayed repetitive vomiting, often really bad vomiting, almost exorcist style, so typically projectile, and they just keep vomiting. And when I say delayed, it's usually right around 2 hours after the exposure to the food. It can be anywhere from kind of 1 to 4 hours is sort of the window that's mentioned in the diagnostic criteria and the guidelines. But the vomiting is so bad that you end up with other signs, which typically are going to be extreme lethargy and extreme pallor. So these kids look really sick when they present. And that's kind of the classic presentation of acute FPIES. Chronic FPIES is related, but it's kind of a different presentation. So that's typically going to be earlier in infancy, often within the first couple months of life. And it's usually going to be in a formula-fed infant because it's usually going to be milk formula or soy formula that's triggering it. And because of the ongoing exposure, you don't really have that classic presentation where you have a nice 2-hour delay to fit the criteria. So they kind of tend to have chronic diarrhea, chronic vomiting. If it goes on long enough, they will have dehydration and failure to thrive. They can come in looking really, really sick.
So this is why this baby's case was so confusing. She was switching back and forth between breast milk and formula, and she wasn't reacting to the breast milk. So chronic or ongoing, long-lasting FPIES, those kids don't have time to recover before they're exposed again. So they are like always sick. And acute FPIES, not cute, it's never cute, but acute cases, that means the person has symptoms and then they don't. One of the big clues is pallor. You heard Dr. Parrish mention that. It's very remarkable. And the kid is really pale, unlike what I've ever seen in other kids. These kids are pale when they have FPIES. Dr. Parrish said FPIES often will appear for the first time when solid foods are being started around 6 to 7 months of age. And that makes sense if the reaction isn't to something like formula or milk. So I wondered if parents can tell that the reactions from food from the very start. Because if the kid is vomiting and sick and it starts hours after eating, how can a parent tell?
It often takes multiple reactions for them to figure it out. So it's really not uncommon at all for kids with FPIES to end up in the ER getting a sepsis workup. And that's true for both chronic FPIES and for acute FPIES. I mean, I've even seen patients who presented, they were getting fed a bottle dropped off at daycare, and then the daycare is calling saying, oh, your child's sick again. And then I've seen kids who got flown by helicopter from rural Texas to Dallas to get taken care of when I was working there at UT Southwestern. And these kids would get a full sepsis workup because they look like a septic infant. They look extremely ill. They're often in shock when it's a bad reaction like that. And, you know, common things being common, they get the sepsis workup, and making that connection with the food can be pretty difficult early on. I've even seen kids where it wasn't fully clear until they got discharged from the hospital and then got fed another bottle, and then they come back 2 hours later with the same symptoms. So it's a challenging diagnosis for sure.
See, that's the baby I was telling you about at the beginning. The symptoms can look like infections. It can look like a stomach virus, even poisoning, which is one of the reasons it took doctors so long to recognize it. If you've never heard of FPIES before, you're not alone. In fact, for most of modern pediatrics, doctors didn't recognize it either. I mean, kids were having the symptoms, but the pattern was hard to see because it didn't behave like a typical food allergy. So for many years, these episodes were blamed on something else. It wasn't until relatively recently that FPIES began to be recognized as its own medical condition. In fact, it wasn't formally given its own diagnostic code until recently, which meant doctors didn't even have a way to diagnose it. So I asked Dr. Parrish to explain when medicine really started recognizing FPIES and why it took so long for us to start diagnosing it.
There wasn't even an ICD code for it until I think 2016. There weren't consensus guidelines until 2017. So we're definitely recognizing it more. But like all atopic conditions, allergic conditions, I think we are seeing more of it as well. And another reason why we might be seeing more of it is we now know for the prevention of IgE-mediated food allergies, we need to be introducing common food allergens earlier. And as we've been doing that, we are starting to see decreases in peanut allergy, for example. But we are seeing more FPIES reactions to those foods, particularly peanut and egg. We're seeing more commonly as FPIES trigger foods now than we ever did before.
I know that parents are hypervigilant about food allergies these days. I see it in clinic. But FPIES is different because the kid doesn't have hives and the reaction is delayed. So it doesn't look like a food allergy. Is it a food allergy?
So it is an allergy because it is a food specific. It's specific to particular foods, and it is the immune system reacting. So in the food allergy world, we try and break down the umbrella term of adverse reaction to food into things that are immunologically mediated and things that are due to kind of inherent characteristics of either the food itself or the person who's eating it. When it's due to just an inherent feature of the person or the food, and the immune system is not really involved, that's when we would use the term intolerance. And the classic example of that would be lactose intolerance, where you have difficulty digesting the sugars in milk, and it leads to gas and bloating and sometimes diarrhea. Whereas with both classic IgE-mediated food allergy and with FPIES, the immune system has a specific response to, most of the time, food proteins, and it's reproducible, and it's not a non-specific or non-immune mediated thing. So we would call it a food allergy. It is quite distinct, though, from those classic IgE-mediated reactions. So to think about why FPIES is delayed, I think it helps to think about why classic food allergies aren't typically delayed. So with a classic food allergy, you have IgE antibodies that have formed from some sort of prior exposure to that food, whether that's through the skin or through prior ingestion. And those antibodies are sitting bound to mast cells or basophils that are found on the skin, in the respiratory tract, and in the GI tract. And those antibodies are bound there. So when you eat the food, it gets absorbed, it binds those and releases all sorts of nasty things that cause the symptoms of an allergic reaction. And that process happens very quickly because those antibodies are sitting there on the surface of those cells ready to go. With FPIES, the way that I explain it to families, and our understanding of the pathophysiology of FPIES is really still evolving, but the evidence we have to this point is that it's really more the innate immune system reacting. And the way that I explain it to parents, it's literally as if the body is mistaking a chunk of the food protein as if that were a protein from a viral particle. So it's basically as if your body thinks that you have a viral infection, and the symptoms really do look a lot like an acute stomach bug, as we would say. Because of that, you don't have sort of a preformed response ready to go. You're eating it, and then that's stimulating your innate immune system and triggering a response that takes a little while to build up.
It makes sense that it would be difficult to diagnose since it looks different in different ages, and the symptoms are almost like, not like a 24-hour bug, but more like a 3-hour stomach virus. Your brain might need a break now. This is heavy stuff. So when I come back, we'll talk about adults with FPIES. This is totally a thing, and their symptoms are completely different from those in babies and little kids. In fact, you might know someone with FPIES, and we'll talk about what to look for. Okay, I'll just tell you now. It tends to be people who just don't like a food and avoid it. But I'll tell you more after this. As someone who talks about health every day, I can tell you that lasting change beats extreme change every time. And when it comes to weight loss, having medical guidance matters. With Weight Loss by Hers, you're connected to a licensed provider who learns your history and determines whether treatment is right for you. If it is, your plan can include oral medications or GLP-1 injectables, plus ongoing support, medication adjustments, and practical tools for tracking sleep, hydration, and movement. I like that Hers is personalized, science-backed care designed to help you make steady progress you can maintain, not something you're going to abandon in 3 months. If feeling stronger, healthier, and more like yourself is part of your plan this year, this could be worth exploring. Feel like your best self again. Visit forhers.com/Dr. Wendy to get a personalized, affordable plan that gets you. That's forhers.com/DRWENDY, forhers.com/Dr. Wendy. Weight Loss by Hers is not available everywhere. Compounded drug products are not approved or evaluated for safety, effectiveness, or quality by the FDA. Prescription required. See website for full details, important safety information, and restrictions. Actual price depends on product and plan purchased. I always read the label on food and drink packages, and honestly, most sports drinks, they don't make the cut. They always have too much sugar. And then there are the artificial ingredients that you just shouldn't put in your body. That's why I feel good about Cure. Cure is a plant-based hydrating electrolyte drink mix with no added sugar, just clean ingredients and only 25 calories. I use the Cure hydration packs all the time. They make drinking enough water easier because they taste good. From a science standpoint, hydration works best when you combine fluids with electrolytes. That's how your body absorbs water efficiently. Cure uses the same formula proven to hydrate as effectively as an IV drip. And for kids, Cure Kids mixes are formulated with pediatricians and free of artificial ingredients and common allergens. Staying hydrated isn't just about water, you also need electrolytes. That's why I recommend Cure. It's clean, tastes great, and my patients love it. You can grab Cure on Amazon or find a store near you at curehydration.com/Dr. Wendy. That's DRWENDY. Real ingredients, real hydration, ready for the whole family. I have to tell you, I love when I walk into one of my exam rooms and I see a patient making something. I'm not kidding. Some parents bring craft projects or science builds to their doctor's appointment. And here's the thing. These aren't parents that have unlimited time. They're just resourceful. And I know their secret. Most of them subscribe to KiwiCo. KiwiCo delivers those hands-on project crates, and they have them for every age, filled with activities that spark curiosity. I recently got one of their baby crates, and it had the coolest developmental playmat. As kids get older, there are crates that are focused on science, engineering, geography, you name it. You never know what your child is going to fall in love with until they're exposed to it. And KiwiCo makes it so convenient. A crate just shows up at your door every month, and you can pause it or cancel anytime. Tinker, create, and innovate with KiwiCo. Get up to 50% off your first monthly crate at kiwico.com with code Dr. Wendy. That's up to 50% off your first crate at kiwico.com, code DRWENDY. Panda Crate is an exception. See site for details. Now you know about FPIES, and doctors know about FPIES, but it is still so hard to diagnose. Why? Here's Dr. Parrish.
The delay in diagnosis is often just due to the difficulty in recognizing the pattern. And also, some of the most common food triggers of FPIES are not foods that people tend to be on the lookout for as food allergens. So for example, for solid food FPIES, oat and rice are way up there as far as common triggers, and they are not common triggers of more classic types of food allergy. It typically takes a second or sometimes even a third exposure for the pattern to really become evident.
I mean, yes, it's also tough because oat and rice seem to be in everything as an added ingredient. So it would be really hard to identify what's causing your symptoms when they happen hours after eating. And it's an ingredient that's in lots of foods. I'm going to come back to this. In the case of our daycare baby vomiting patient, the daycare workers were seeing the symptoms but hadn't given a bottle yet. The mom gave a bottle right before drop-off, and she didn't see the symptoms. So neither of these parties had the information to figure out what was going on. Plus, mom was eating dairy.
FPIES reactions to foods passed through breast milk are actually pretty rare. There are case reports of it. My younger daughter actually had it that way. but it's uncommon. So just because a child is tolerating breast milk that may have that food in it through the mom's ingestion of that food, that doesn't mean that the diagnosis can't be FPIES at all.
Now we've gotten the FPIES diagnosis. So I assume the treatment is to avoid the food, but is that the only treatment?
Avoidance and then emergency preparedness. Now, what emergency preparedness looks like for FPIES is quite different than for classic food allergies. So epinephrine, which is the mainstay of treatment for anaphylaxis, the only first-line treatment for anaphylaxis, it's not indicated for treatment of FPIES. It doesn't reverse the FPIES reactions. The most helpful medication for FPIES reactions is actually ondansetron, which goes by the brand name Zofran. When they show up in the ER, if the ER doc is thinking that it's a viral gastroenteritis, they're going to get that medication anyway. So that's something in the history that, when I hear, they got that and they got better, that actually further supports the idea of it being FPIES. So that's kind of the main thing. The other thing is just hydration. So in many cases, you're going to be able to keep the child hydrated orally, but some kids will need IV rehydration, especially if they're tipping over to the point where they're hypovolemic, or some kids even get hypothermic with these reactions.
So is there hope? A lot of people with food allergies, the anaphylaxis kind, like to peanuts, some of those people do outgrow their allergy. Do kids outgrow FPIES?
Most kids do outgrow FPIES. If you look at the data, you have probably 3/4 of kids outgrowing it by the time they're kindergarten age, and probably half of them outgrowing it by the time they're kind of 2 or 3, so kind of during those toddler years. Another thing that's fascinating about it is if you look at what foods are common FPIES triggers, it does vary around the world based on when the foods are introduced. So in the Mediterranean, seafood is a very common trigger for FPIES even in babies, because they'll often give them, like a fish soup or things like that as part of their early diet. And in the US, we don't really see that just because people don't feed their kids seafood with the same frequency. Avocado has emerged as a really big FPIES trigger in recent years. Initially, it had been categorized as a low-risk food, but it's, I think as people become aware of, it's generally a pretty healthy food and it's kind of trendy and everything. So more people are feeding it to their babies early. It's nice and mushy. It's kind of a good food for babies to eat. And so we're seeing more FPIES to it. The other thing to remember about FPIES is it's a syndrome. So it's really just a collection of symptoms that we've decided to label as FPIES. I really think there is kind of a spectrum of FPIES-ish symptoms as well. So you might have a patient who has some vomiting or gets really fussy after a particular food, but doesn't meet the full criteria. Those kids could still be managed basically the same as FPIES. You could still say, okay, we're going to avoid that food, and then we'll try it again 6 months or a year later and see if that issue is resolved. So it's something that, though, if you don't think about it, you're never going to make the diagnosis, like with everything else in medicine. But it's something that, as an allergist, when I see a kid with an issue with vomiting, it's at the top of my mind. But for other clinicians where FPIES isn't a big part of what they do, it's not going to be top of mind for them.
FPIES can mimic other conditions, and the reaction isn't immediate. So what is the best way to diagnose FPIES? If you are a parent, Dr. Parrish's answer is not going to surprise you.
Parents are good detectives, and moms have really good instincts. So if a mom is asking, could this be the food, take it seriously, because mom's instincts are almost always really, really accurate. So that would be my advice, would be basically, if a mom is questioning if weird GI symptoms could be due to a food, take it seriously and then start thinking about it. Because I would say most of the patients that I see with FPIES, the mom is the one who suspects the diagnosis first and then seeks out the allergist.
I'm a mom and a pediatrician, and I'm going to tell you a real fun story. I am a good detective. I have always had an aversion to brunch and fried rice. There were lots of foods that I just wouldn't eat. And in my 40s, I started to get horrific stomach pains. Starting about an hour after eating, I would double over in pain and then 2 or 3 hours later be completely fine. So I avoided weird things like orange juice and bananas. And then one day, I ate an egg white salad all by itself, and I had the worst symptoms ever. And that's when I realized I have FPIES to egg white, not egg yolk. I can eat mayonnaise and carbonara, but a piece goes sour with egg white foam? Ugh, I want to die. Does this sound familiar? Do you know someone like this, a food avoider? Dr. Parrish does.
I bet most people know somebody in their family who says, oh, I don't eat shellfish. It doesn't sit well with me. Or, they have some food that they avoid because of some vague GI symptoms. I think a lot of those people probably actually have FPIES to that food, and it never gets labeled because it's, as an adult, it's in particular, once you've recognized it, a lot of times they end up with an aversion to it.
FPIES is a good reminder that the immune system does not always follow the rules. When most people think of food allergies, they picture hives, swelling, or trouble breathing that happens within minutes of eating something. But FPIES is different. The symptoms are delayed, and instead of looking like a typical allergy, it looks like something completely different, like a stomach virus or food poisoning, or even a bacterial infection. Once the pattern is recognized, though, it is incredibly reassuring for families. Knowing what's going on means you can avoid the trigger food. You can have a plan when a reaction happens and understand that most children might grow out of it. As awareness grows, we are likely to learn more about this unusual immune response and how to better diagnose and manage it. I want to thank my guest today, Dr. Christopher Parrish, for helping us unpack this fascinating and confusing condition. Dr. Parrish practices at Latitude Food Allergy Care, where he specializes in diagnosing and treating complex food allergy conditions. And as always, thank you for listening. If you've enjoyed this or you just feel a little smarter, I really would appreciate it if we would follow the show or share it with a friend. I can only do this because I have you as a great audience. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.
Jackson Hewitt has a great tax prep deal, $149 or less. Missing out is like ignoring the check engine light in your car. You'll regret it. Seriously, the price is only $149 or less, no matter how complicated, so don't wait. Like when you get a password expires today alert, or you're shopping online and there's only one item left. It's like your taxes are in the cart, just complete the purchase. Hurry! This deal for $149 or less is like your phone at 1%. It's about to power down. Limited time offer for new clients on federal returns. Participating locations only. Terms at jacksonhewitt.com/149.
Stitch Fix. Shopping is hard. Let's talk about it.
I don't have time to shop for clothes.
I have to buy everything in 3 sizes to find one that fits. They know me at the post office.
Workout wear is my only wear.
Stitch Fix makes shopping easy. Just show your size, style, and budget, and your stylist sends personalized looks right to your door. No subscription required, plus free shipping and returns.
Oh, wow, that was easy.
Stitch Fix, online personal styling for everyone. Take your style quiz today at stitchfix.com.